women?
So when it comes to pelvic floor therapy, and especially, I'll speak mostly about the pregnancy and postpartum population because I do see women even outside of that, but we'll talk about that after. But when it comes to the pregnancy and postpartum population, I typically recommend for women during pregnancy to start pelvic floor PT at the beginning of their second trimester. Once they've gone through their first trimester, everything has looked good, they've gotten some of their scans done, we can start at the beginning of their second trimester to get a good baseline of where they're at from like a physical perspective. A lot of women want to be working out during pregnancy. They don't really know what's safe. They don't really know what to do. So either they don't do anything at all or they get their advice from social media, which is a rabbit hole we can go down in a little bit because that's a whole other.
We will.
Yeah.
So first trimester, like you haven't grown much or most people haven't. Beginning of second trimester, as you're talking, I'm like, oh no, I'm late.
No.
Because I'm almost at the end of my second trimester.
No.
But is there anything that like in particular we should be looking out for symptom wise that's like, okay, run to the pelvic floor therapist?
Yeah. So a good rule of thumb in general, even without symptoms during pregnancy, I always recommend for women to at least come in for an evaluation. But one thing that I hear very commonly that a lot of women during pregnancy will experience is they pee when they laugh, sneeze, cough, or like they have like some leakage. And they think that it's something that's, it's just like part of pregnancy. And they think that, that's just like part of it. And it's not. Because typically that means that there's something going on that postpartum is only going to really amplify. So usually like we can get ahead of it during pregnancy to help teach women the proper pressure management strategies, the proper breathing mechanics, the proper core engagement strategies that are needed in order to prevent it. So Kegels are like the worst thing that you can do, especially during pregnancy, but also just to really help like with incontinence. Like it doesn't really do much for you.
Are they actually working against you?
So when it comes to pregnancy, and especially when you're getting closer to your delivery date, you do not want the pelvic floor to be stronger. You want it to be able to like expand and lengthen so you actually can give birth without having difficulty and resistance from the pelvic floor.
So you don't want it tight. You want it. Like, I feel like it's like we need to do like internal yoga.
Exactly.
We want to be like limber.
Exactly.
Okay, that's really interesting.
Yeah.
And then is there a nervous system piece to this?
Yes. So we'll touch on the nervous system because nervous system regulation is one of the biggest pieces that I will touch on with like no matter what the population is, postpartum, pregnancy, even like nulliparous women who have never had children before. The nervous system is a huge, huge component. And the reason being is because think about it like when you're stressed, when you're anxious, when you're frustrated or anything like that, your body is going to start to like harden, tense up, your shoulders get stiff, hands get stiff, maybe you're clenching your jaw, you're grinding your teeth. The whole body will tend to stiffen and harden. The pelvic floor is naturally going to respond to that as well. So the pelvic floor will also become more tense, and that can exacerbate a lot of pelvic floor symptoms as well. So especially when it comes to women dealing with like urgency, pelvic pain, even incontinence, like the whole spectrum of symptoms that most women will experience in the pelvic region, nervous system is usually like first line of defense.
Because I'm thinking about it too, and I'll get into like a little bit of experience I had even like way before pregnancy with pelvic floor, but I felt like there was a big tie, not only with nervous system, but just with like muscle tightness as a whole and digestion.
Yes.
And that's where like I've always noticed, you know, the more stressed I am or the more dysregulated my nervous system, my digestion's always affected.
Yep.
And then it was like, so I guess I'll just tell the story. So I was training for a half marathon and I started just getting this pain in my like lower left abdomen. And it started like I got a sharp shooting pain during sex. And I was like, okay, that was what I was like, okay, this is not normal.
Yeah.
And I was worried it was like, I have PMOS, formerly known as PCOS.
Yes.
And I was like, I wonder if this is like a giant cyst or something. And so I went to a few different doctors and they like, there were no cysts. And we finally came to the conclusion. I went to like a pelvic floor OB, like I don't know, she was some specialist at NYU. And she was like, are you training like abnormally hard? And I was like, yeah. She's like, are you like stretching and doing like mindfulness work? And I was like, no.
You're like, no.
Yeah. And it was like, it was just muscle tight. It was internal muscle tightness. And it was also affecting my digestion where I wasn't able to like fully, like my colon was getting affected. Is this common? Do you see this often?
So that particularly, it's not super common that I've seen, but when it comes to like lower abdominal pain or even like hip flexor, like deep hip pain, that's something that I see all the time.
Probably with runners a lot.
100%,
right?
especially with like runners or like anyone who's very active and they're like overtraining. When there's any like muscular imbalance, the body is very good at compensating and like using other muscles to find the stability. So that's why, like, especially if it comes to like tight hip flexors, stretching your hip flexors all day isn't going to really do much for you because we actually have to be able to train the muscle to slowly lengthen with strength, but also give it the support that it's looking for, which is why it starts to like tense up a little bit. So it gets like very complex when it comes to like figuring out which muscles are actually really tight and are causing the symptoms.
Yeah.